start with this. Okay. So it's 6 o'clock and it is Friday. So let's just start. It's a great pleasure for us to greet our next presenter, Dr. Shino Bay Augilera, who is a world-renowned cosmetic dermatologist, dermatologic surgeon, cosmetic laser expert, and is dual board certified with a fellowship in dermatology from the American College of Osteopathic Dermatology. He has over 17 years of ongoing advanced training in lasers and aesthetics, and is a clinical researcher, publisher, former chief medical director of the dermatology residency program at Nova University, and assistant professor of dermatology for 4 other universities. He's a top requested international physician trainer, and a keynote speaker. Dr. Augilera travels the world teaching physicians the proper use of the newest laser advances and cosmetic techniques. He participates in FDA clinical trial studies for a leading global laser manufacturer and is called upon to determine the best treatment protocols to maximize the safety and efficacy of emerging technologies. And with him, we are teaching residents at the region, and he's also, the author of this book, Be Youthful. And actually, I went online, and I was really astonished when I looked at Amazon, because I don't know, I hope you guys can see my screen. So it is his book, and he has 48 customer reviews, and he has 5 stars. So I was going down that it is almost impossible, to have 48. Everyone gives 5 stars for him, but actually this is possible. And there was only one person who gave 4 stars, so he was also very much satisfied. And about the reviews, I think that I really love this review, who said that it's a very well written, concise, and clears all the hype and what to do to improve facial appearance. And he also, or she also, says that he has a huge heart and truly wants to help, and is very generous with his advice. All I can say is a huge thank you to Dr. Aguilera. And we are professionals, we are doctors, but we also know that only a few doctors are out who has a true gift. And that's why I'm so happy to have him on the program today, because he is having this gift, how to transform people, how to preserve youth. And I'm extremely excited to have him on the program. So for all that, I'm going to change the presenter for Dr. Aguilera, and I'm giving you now the presenter screen, and please start your presentation. Thank you so much for volunteering to be on this international program.
Okay, so hello everybody, and thank you for coming to this lecture that I'll be giving about Bruxism. This topic that is close to heart to me, because I myself, I clench and grind my teeth at night. So about 12 years ago, my dentist told me that I clench my teeth, but I didn't do it so severely back then, and I took a look at my teeth, and they didn't look like they were being grinded. So I decided to not wear my mouth guard. But I would have liked for the dentist or anybody to would have explained what would be the ramifications if I didn't use it, especially since I'm an anti-aging doctor and aesthetic doctor. So right now, at 47, I have bone loss, which the dentist said maybe in 5 years I'm going to need bone graft. So this is a topic that I'm going to move my screen. Let's see.
Yep.
This is a topic that most of us don't seem to know much about it. Dentists do know a lot, but there's a lot of consequences about ignoring bruxism. So you can see in this slide that there's a lot of problems from headaches, migraines, vertigo, and that's something that we find. A lot of patients suffer from vertigo. They go to the ER, they get $1 million workup, and nobody seems to know what it is. The patient thinks, he or she is dying, and they get antivert to control the vertigo, but they're still incapacitated because we all know that antivert makes you a little, feel a little drunk. So either you dizzy and spinning or you're feeling drunk. So it takes a lot out of somebody's life. Another thing that a bruxism can cause is pain behind the eyes, also discomfort on the neck area, like neck pain, muscle soreness, shoulder aches. So if you can see on the screen, there's a lot of symptoms that bruxism is the culprit, and nobody seems to have an answer for these patients. I'm trying to move my slide forward. Let me see, there. So what is bruxism? Bruxism is basically when you clench your teeth or you grind your teeth. So basically people hold their top and bottom teeth together really tight. And grinding is when they slide. Usually people that grind, they make noises. You could hear their teeth being grinded. And then you have TMJ, which is a severe case. So it's kind of like a spectrum from clenching, grinding, and then having TMJ. TMJ having the more severe symptoms. Patients with TMJ, they really, really suffer with a lot of pain besides all the symptoms that I mentioned before. So one of the biggest cause of bruxism is stress. Basically, is how we deal with stress. So we think that it's a bad habit of how to deal with stress that we encounter during the day. So during the day, you may be pressured, you have deadlines, of being very stressed at work, and when you go home and go to bed at night, then you start clenching your teeth. So factors are how much stress you are under, how long and tightly you clench and grind your teeth, whether your teeth are misaligned or your posture, your ability to relax. Diet is also thought to be a culprit, and sleeping habits. So sector bruxisms usually will be earache due to, in part, because the structure of the temporomandibular joint are very close to the ear canal. You can feel pain in a different location that is source. This is called referred pain. So it all starts with the muscle of mastication, but you get referred pains in other areas. For example, people complain of pain behind their eye. And actually, for the first time this morning, I experienced that. I got up and I thought it was my contact lens, and I took it out, cleansed it, and then I still experienced pain behind my eyes. It was a sharp pain and pressure behind my eye. And then, as the day went on, it disappeared. So there's a lot of symptoms of bruxism that we do not correlate it to this bad habit. Again, muscle tenderness, insomnia, sore and painful jaw, and the one that is most common that a lot of people suffer for years and they never get a diagnosis, being vertigo. So have anyone in the past, if you're looking at this picture, you see that the root of the tooth is exposed. Has anyone ever heard that you are brushing too hard? So basically, this is what I was told. I have a lot of this. My teeth look great, but I have a few of the root exposed in some of my teeth. So now they find that exposing the root canal, it has to do a lot with bruxism as well. So how do we deal with it? Well, there's a lot of things that you can do at home for self-care. If you feel soreness, you can do ice or heat together. You just do first ice, and then later you can do heat pads. That's for muscle and soreness. Also, you have to avoid eating, hard foods like nuts, candies, and if you're eating a steak that's too thick. Avoid chewing gum and drink plenty of water every day. Getting plenty of sleep, we all know that really helps with dealing with stress during the day. And then doing things like meditation, yoga, massage therapy can probably reduce and alleviate the symptoms of Bruxism. Another thing that I do that seems to work really well is either taking magnesium at night orally, or I take L-theanine, which is the flavor of green tea, and it has very soothing and relaxing effects. I swear by it. I think it really, really helps with dealing with the stress of the day. Any brand will do because it is only one place in the world that makes L-theanine, and then other companies sell it with their own logo and the brand. So even whole food L-theanine brand will be very, very effective. You could start with a dosage of 100 milligrams. Right now I'm doing 200 milligrams a day, but it really, really works within 20 minutes. Things that tend to get you excited or stressed, or people that push your buttons, you really won't react too much to them. And if you take it at night, you have a really nice sleep, and it will relax the muscle of mastication. Another thing that you can do is using the mouth guard. The best one is the one that the dentists do because they do a really nice mold of your teeth, so it's a little bit easier to keep in your mouth at night. Me, I couldn't sleep with it. I was salivating a lot and I just felt pressure on my teeth, so that was the reason I never used it. But if somebody would explain to me that in 12 years I was going to have bone loss, I would have probably tried harder. So it's very important to educate your patients. So what am I doing for myself? Since I cannot wear the mouth guard, I use neurotoxin. So any of them, Xeomin, Botox, or Dysport, would be a great alternative and a great relief for people that suffer from Bruxism. I can tell you how many lives I have changed throughout the years just by doing this. Patients that have been suffering for years with vertigo on and off, patients with severe migraines and tension headaches get great relief with this. And not to mention that women lose about 30% bone in the jaws. So for anti-aging, if you know that your patients are clenching or grinding, then this will be a really great solution, and in the long run will be a very inexpensive way to preserve the bone on your jaw and your teeth as well, because we all know that tooth implantation is very costly in the United States. Now, one thing to keep in mind, especially somebody like myself, I'm very thin and I have a very thin face. So we use neurotoxins on the muscle of mastication, especially in masseter muscle, and the parotid to reshape the face, especially on Asian types individuals that want to have a more chisel and contour jawline. We use neurotoxins to achieve this look. So the dosage is very important. To do contouring of the face on an Asian individual, we use dosages from 25 units to 30 units. Somebody like myself, you do not want to do that because you're going to make us look very gaunt. So for somebody that is very thin, you may want to use dosage starting with 15 units per side, and then gradually you may increase it if needed. I usually tend to inject just the masseter muscle unless the clenching and grinding is severe. Then I will go to the temporal muscle and inject neurotoxin in that area as well. So basically, using this technique of neurotoxins in the temporal muscle and the masseter, we allow your patient to age slower around the mouth, save their teeth, in several ways. Root canals, the culprit point, just getting cracks on the tooth and bacteria getting down to the root and causing patients to get a root canal. But this technique will also alleviate, like I mentioned before, a series of ailments that patients suffer, such as headaches, muscle soreness, jaw pain, tenderness, tooth sensitivity, numbness on the teeth, migraines, and vertigo. So you can see with advancing years, the area of the jawline is going to change naturally. It's part of the aging process. So the upper lip will lengthen, the vermilion borders will thin out, lines will start appearing, especially in women, because the skin is a lot thinner than men, especially in that area. They don't shave, so the skin is thinner. The lip pocket disappears, the corner of the mouth starts to turn down, the bony support shrinks, and the jaw moves retrograde. Now, females and males will age differently around the jawline. For example, for a female, the upper and lower mandible will move retrograde, and the lateral sides of the jaw will move interiorly, it will move inwards. What that does is that mechanically a woman's jaw will move farther back than a man. And that's the reason we see that women suffer with this area. They may look amazing everywhere on their faces except around the mouth or jawline. The jawline of a man, the movement is a little bit different. The front, the tip of the jaw will move retrograde, but the lateral aspect of the jawbone will move upwards. Mechanically, when you do that, the tip of the jaw cannot move too far back because mechanically it would be impossible. That's why men don't have a lot of problems around the mouth. And when we do, it's usually when we're getting closer to 60 years old, 60 years of age.
Shino, I'm sorry to interrupt you. It is fantastic, but do you mind using the arrow a little bit so we can see sometimes? Yeah,
Perfect. Yeah,
thank you so
definitely.
much.
Okay. So as you can see here on these two photos, the first one is the photo of a younger individual, and then you could see the changes on the bony structures. So you could see that part of the aging process is bone loss on the face. Um, so basically what happened, the zygoma was starting to shrink, and you could see it on this side as the zygoma started to shrink. You could see that the orbit will elongate in all directions, and you could see right here on the jawline how much it has shrunk, it has lost a lot of volume, and that caused the loss of support. Now, I always tend to educate my patients about bone loss and fat loss. So for most people, you start to age around age 40 or close to it, and you will look older, but you just look tired. It's a tired look. It's not an elderly look. When you start to lose the bone, especially in this area, that's when you acquire elderly looking features. So that's why when my patients are 50 plus, I trying to preserve the architecture of the bone or trying to work in the bone area because there's nothing worse to have the skull of an elderly person with the volume of fat of a very young person. It looks very inappropriate and sometimes quite scary. So this is what we call the concertina effect. When we're little, we have lack of support from the bony structure, and as we get older, the ratio that we see in a baby is almost close to the same ratio that we see in an elderly looking person. So the soft tissue lacks its support. So without bone in the face, um, there's no youth. So it's very important to work in that area, especially for women. Women will lose 30% more jawbone than a man, and it has to do with menopause, we believe. So this is a picture that shows a young female with a very thick, prominent jawbone, and you could see the changes of an old female where the jawbone is a lot thinner, has lost everywhere is thickness, so is the soft tissue won't have the scaffold to be in the original position when the patient was a lot younger or in the long years. And you could see here this U-shaped deformity that has to do with loss of support from the jawline. And sometimes we also, unfortunately, tend to accumulate fat here. We don't lose a lot of the fat cells here. So you have fat accumulation and the lack of the support of the jawline, which we can recreate with products like Radius and Sculpture Aesthetics, which I like to use a lot to imitate the architecture of the bone. Then, as I mentioned before, the main lateral jaw widens. So as we're getting closer to 60, you can see that mechanically the lateral aspect of the jawline will have an upwards movement, while a female will be an inward movement. The tip of the upper and lower mandible in a male and female both will move retrograde. And a good example of that, we could appreciate how nice and strong jawline John Travolta used to have. And you could see now almost close to 60, the jawline have moved outwards. So basically I joke that as we get older, a man gets a bigger head. So how do I know when a patient during consultation is already moving retrograde, or if a patient that is young has already started experiencing bone loss and bone remodeling? So I usually, when I do my consultations, I try to pay attention of what type of movement the patient do with their mouth. If the patient has signs and symptoms of aging around the bone and the jawline or the tip of the chin, I know that the patient has to be clenching, grinding, or have TMJ. If a 40-something-year-old patient has a mouth of somebody that should be a lot older, like in their 50s or 60s. So there's three different types of movement that I tend to see. One is where they press really hard, causing a d'orange or pebbly-looking chin. That creates lines that are, that this movement doesn't create lines, but it creates this pebbly area. And what we do is, to alleviate this, is put neurotoxins, and it will help with this. But eventually the patient will learn to do one or the other two movements that I'm going to show you. So this one is when the patient purses the lips, and this type of movement, it will create this type of vertical lines. And the other movement is what I like to call the Steven Tyler. And you could see the type of wrinkle that the patient will have in time for excessively doing this movement. So why are they doing this movement? Why is this muscle hyperkinesis taking place? Well, we're losing the support. The jawline is moving inwards on a woman. The tip of the jaw is moving retrograde. So the muscles around the mouth is losing their support. So patients need to do this movement to maintain the mouth in their position, original position. So most of the patients don't know that they're doing this movement, but they know the symptoms, and the symptom is wrinkles around the mouth. So they always go, I never smoke, why do I have this mouth full of wrinkles on the lower lip area around the chin? And I tell them it's the same reason why they use Botox on the forehead and CrossFit, muscle movement, is that before they never had to move like that. The problem is that if you don't address this early, you, like I mentioned before, not only you get premature bone loss, but you may be one of those patients that will experience severe tooth loss. And this is a lot more aging than just having a little bit of bone loss on the jawline. And very expensive to correct. So what do we do? Well, the problem is with ignoring the changes on the bone around the jawline and chin is that it's going to be very hard to maintain this area useful. So what most patients do is they just chase the symptoms. They start getting fillers to alleviate the lines. They also do lasers like the CO2 to eradicate the lines, but no one is really doing the prevention. It's, instead of chasing symptoms, let's fix the cause. And the cause is that the chin is moving retrograde and the muscles around the mouth they're losing their support. So a good way to help them is to try to prevent it, and that's where I'm using Sculptor Aesthetics. There's other products that you can use, but I like things that behave more like bone when you put it on top of the bone. So we all know that Radius, calcium hydroxyapatite, and Sculptra, put L-polylactic acid, they both used to be bone fillers. Sculptra Aesthetics in the 1960s used to be a bone filler. And what they noticed was that if you inject it or put inside a bone, the osteoblasts lay down your bone. Since we now injected this into the bone, we layering or sprinkling the product on top of the bone gets thicker, but with collagen. So we use polylactic acid to trying to imitate the the bone that once was there, and this will create a lot of support around the mouth. Okay, so my patients that used to do the movement, most of them they cease to do the movement, and that in turn will translate into a more youthful looking mouth, and the symptoms disappear. So these are a few of my patients where you could see that by imitating the bone on the chin, you could see that the corners of the mouth look a lot straighter and the chin has more support. And in the first slice right here, you can see that concertina effect where everything's getting squished. The ratio in this area is very similar to the ratios that you will find in a baby. And you can see that the corners of the mouth look a lot straighter. This is another one. It's a lot of bone loss. You can see that the movement that she's doing is the Steven Tyler I like to call, because there's not a lot of wrinkles here. So she's not pursing, but you could see again the ratio in this area of the chin is starting to look more like the ratio that you find in a baby. This is the concertina effect that we were talking about earlier. And you can see here that there's more support. Now, if you catch them early, you will actually retard these changes. But again, the aging process continues, and it's going to be only so much that we can do. But from all my patients that are in their 60s and now 70, I have managed to maintain a useful looking mouth, and it's definitely an important treatment to have in your armamentarium for anti-aging. You can see that this lady is doing probably a little bit of the two movement. There's a little lines forming, so she's pursing, but she's also have a little bit of the range of pebbly chin. So that shows a lack of support. And you can see in the after picture that there's a lot more support. She stopped doing the movement. The chin looks a lot better. Another lady that's also pursing really hard, and you can see the corners of the mouth, and you see the lack of support. And you can see over here, you can see the lack of support in the lateral jaw as the lateral jawbone is moving inwards from volume loss. So what do I tell my patients that have bruxism? Well, I usually tell them, number one, that listen to your dentist and wear the mouth guard if they're recommended to you. Take healthy and endurance days to help you with dealing with stress. Do activities like yoga, exercise, meditation, which I tend to do a lot. But one thing that I tell my ladies that are 50 plus, because remember, women will lose 30% bone in the jaw area more than men. Anybody plus 50 or anybody that knows that they grind, clench, or have TNG have no business chewing gum. So if they like the minty flavor, I recommend them to use search or TikTok. But we do this movement constantly while we're sleeping. We don't need to continue to do it during the day, especially if you're somebody that have more severe symptoms like vertigo, migraines, and headaches. So with this, I conclude my lecture with Bruxism, and I was very excited to talk about this instead of talking about other things that I do with fillers and lasers, because I'm trying to create awareness not only within patients but within my colleagues out there who sometimes tend to ignore this problem. This problem is real. It's an epidemic. I think most people are grinding and clenching because a lot of us we're very stressed. So it's very, very important whether you do aesthetics or not. If you just an internist or dentist or a family practitioner, we need to talk about it. We need to bring it up. You'll be surprised how many people are suffering in silence with bruxism, with all the symptoms that bruxism can bring. But since I'm a aesthetic doctor, if any of you that are out there listening are in aesthetics too, you know that you're doing a disservice to your patient if you do not talk about it and bring it up, because we have, neurotoxins are disposition, and we have things like polylactic acid and calcium hydroxyapatite, where we can help maintain a youthful mouth, but we also can maintain a healthy mouth. Thank you very much for being here with me.
Thank you very much, Shino. It was fantastic, and it was really kind of a mind opener for all of us, I believe. So now you guys can ask questions, and it is the time. Please, Anne has a question. Do you recommend any type of imaging, or let me see, or do you go by the 3 signs you mentioned?
Pardon, what was that?
The question was, do you recommend any type of imaging studies, or do you go by the 3 signs you mentioned? That's
correct. Yeah. No, imaging studies are not necessary. No, usually, the dentist will be doing that. What I recommend is look at their mouth area when you're talking to them. Most people do these gestures when they're paying attention or in between speech. So as you're talking to them to assess, look at what they're doing with the mouth. If they're pursing or if they're, just doing the Steven Tyler I like to call. I just called it because this is the person that I know the most that tend to do that movement. But any of the 3 movements, look at that. If you see that they're doing, or you see any sign of symptoms in a very young individual, 35, 38, 40 something, and if they have problems that you should see in the latter years, then you'll be able to diagnose. Usually I would just go and tell them, do you clench your teeth at night? And they think that a crystal ball. They get surprised that I know. But it's easy to pinpoint that somebody is grinding or clenching or have TMJ at night just by looking at what they're doing with their mouth.
Do you actually, or could you actually reverse if you are paying attention to this and using the mouth guard and not chewing gums? The root changes. You show the picture of that basically your gingival line could recede. Could you avoid that, or could you get any improvement on that?
Unfortunately, once you have the bone loss and all the changes, it's really hard to reverse. That's why I urge everyone to try to deal and treat this problem early, because there's not going to be able. I mean, you'll be able to, if your gum is receding. They offer me to take from my palate some tissue and then, to transplant tissue into my gum, but it's a very painful procedure, I heard, so I'm trying not to do it. But you cannot reverse, you can improve or mask. So it's important to catch it early. So the continued damage that people continue to do, not only to the teeth, but to the bone, the jawline, and all the symptoms that come with it can be alleviated.
I see. Jennifer has a question. Is it ever too early to start Botox injections into the muscles of mastication? Is there a risk of causing muscle atrophy if you injected too much Botox too soon, or over a long period of time?
Yeah, correct. Yeah. So there's anybody that is having the problem is the clenching, the bruxism. Usually, anybody 20s. I mean, we all doing it. A lot of people are doing it. So there's, unless they're children, I will not inject any neurotoxin. And then, I deal with adults mainly, but there is going to be atrophy again if you're using a lot of units. Remember, that's what we do to reshape the face of Asian individuals or people that have really huge musculars, or females that the muscles are so big and it tend to look a little bit more masculine. You do it and you atrophy the muscle. But if you use the right units and just to relax the muscle, you shouldn't have a lot of problem. I've been doing it for a long time, and yes, the muscle is atrophy a little bit because it's relaxed. Whenever you cut the communication between the brain and the muscle will atrophy. So it's very important that you know what units to use. And very, very thin individuals, keep it in mind that you don't want to use too much to reshape their jawline because they're already thin. But if you have somebody that is a big clencher, they usually have a very strong, big muscular muscle, so they can take a lot of units.
The other question is from Eugene. Is one single bolus injection of toxin into the masseter enough, or do you need multiple injection points?
So what I do is multiple injection points. So a really easy way to do this is you have the patient to clench. So I say bite down and they clench. And I try to feel with my thumb the edge of the masseter muscle. And then I mark the edge and then I inject everywhere around the area. I mark it kind of in the shape of a circle and I inject in multiple size within that circle. I like to mark the edge of the masseter muscle because what you don't want to do is hit the resource muscle because the patient will be unable to smile.
I see. When you are doing the sculpture injections, and you said that there is actually some bone formation, then do you put this close to the periosteal areas, or you put or place it in the soft tissues?
Correct. So since I'm putting the sculpture steady, the polylactic acid on top of the bone, it will turn into collagen, imitating the architecture of the bone. In the 60s, they will put it inside the bone and it will lay down bone. But the way we use in aesthetics, right, we just spray the bone with the polylactic acid and it will start getting thicker with collagen, faking the architecture of the bone by creating some volume, but it will be all collagen. This will alleviate the aesthetic look of the area of the mouth, but it will not alleviate the symptoms of bruxism. For that, the neurotoxins are recommended.
I see. Nick is asking, can you clarify the magnesium dose at night? How much would you recommend?
It's really hard for me to recommend the dosage because there's different. Usually, I take 50 milligrams. There's different dosages. So you go to Whole Foods or the vitamin shop, they have different dosages and mixed with other things like valerian root. So it all depends what you get. So my recommendation, is just magnesium over the counter. So just get, whatever brand that you like and give it a try.
Okay, John is asking, you mentioned another product at night made by one manufacturer. What is the name?
Okay, it's the letter L and then theanine, Theanine, L-theanine. And L-theanine is extracted uh, extracted from green tea, and that's the flavor when you drink green tea. That flavor of the green tea, that's the L-theanine. And what it does is secretes dopamine in your brain. So since you have, which is the happy hormone, right? So you have a lot of dopamine in your brain. It kind of neutralizes when all the cascades of all the hormones and things when you stress. So you cannot feel so bad when you're feeling so good if you have a lot of that dopamine hanging around your brain. So I do it, I'll tell you by experience that it made a world difference in my practice. I feel it when I don't take it. Everybody that I recommended feels the same. You just take even Steven, you don't get excited. People that push your buttons, they don't anymore. So it will allow you to deal with stress a lot better. And it's natural. You don't feel like you're taking anything. You just don't get excited.
That's fantastic. So, I mean, with all that, a lot of holistic advice here. Okay, Eugene has one more question. Sorry. Uh, what's your technique for injecting radies periosteally? And do you use cannulas or needles for it?
Yeah. So I'm a needle guy, and when I inject radius supraperiosteum, I like to do it perpendicular, just straight. You just continue straight perpendicular to the bone and start depositing aliquots all around the jawline. Um, you could use it all around the jawline. Just gotta make sure that you mark the notch where the sternocleidomastoid goes and all the vessels, so you don't go through that. But you could be in front and behind that notch on the jawline. But the best is to use a needle, the provided needle, and just go straight down perpendicular to the bone. When you do that, you tend to use a lot less product. If you use a cannula, which you can do, you'll see that you will need a lot of product to get, the the reconstruction of the jawline. That's what I see when I never use a cannula. I need a lot more product. So it's better to, if you're gonna work on the bone and you wanna lift an area, it's better to do aliquots like temples perpendicular to the bone. I think straight down is a lot better than using the cannula. But that's my personal preference. I know that some of my colleagues, they love using cannulas.
And how long will this injection last? I mean, if you put there, then like months, years even, or
Yeah. So with radius, you could get about 9 to 18 months. It all depends on the patient, and we all degrade things differently. Sculptra is supposed to last 2 years, but this is what I do to my female patients, again, because they lose 30% more bone in this area. Once I do Sculptra, and I try to do Sculptra in all the areas of the bone, including the cheek, the zygoma, any area that have remodeled or will change in time to help patients stay young looking or make patients look a lot younger, especially the elderly looking. So my recommendation for my patient is that, yes, around the zygoma and cheek area, you may get up to 2 years. But what I don't want is my female patients to come back with 2 years of bone loss. So I always want to see them at the year mark just to assess and see if I need to put a little bit more in that area. So that's my recommendation if you're using Sculptra aesthetics. Radius is not going to last as long. So you want to see them maybe every 6 months and then assess if the jawline is changing, if the chin is moving retrograde, if the muscles around the mouth are losing support. The best thing is trying to educate the patients about this so they can actually be more proactive and come to us when it's easy to maintain, right? We don't want train wrecks, you know, so that's why I don't want my patients to come back after 2 years of doing the procedure.
Fantastic. Well, thank you so much again for coming on, and it was we greatly enjoyed, your wisdom and your advice on this topic, and we learned a lot. So, wishing to you and everyone a happy Thanksgiving for next week, and we probably not having a lecture for next week, but we will come. I think Dr. Zayak is going to give a talk in December, so we start with that. So again, with that, thank you so much. We greatly appreciate it. For everyone, have a good night, have a great weekend, and happy Thanksgiving. Bye bye.
Bye bye. Happy Thanksgiving, everybody. Thank you.